Good morning. My name is Betty and my student ID number is S333935. Today I will be presenting a topic concerning analyzing the strengths and limitation of assertive communication. Communication is one of the important skills in health and social care every day. Health professionals such as doctors, nurses, care workers, therapists, they all use communication. This communication, it helps the professionals to communicate to the families, to colleagues, and even service user. A good communication helps professionals to understand the people's needs, provide appropriate support, and deliver effective care. Without communication, without effective communication, misunderstanding can occur, which may lead to many things like conflicts between the professional and service user. The communication style that I have chosen is assertive communication. But let me define the term assertive communication. Assertive communications mean expressing thoughts, feelings, opinion, and concern clearly and respectfully. It allows individuals to communicate confidently, respecting the right of other people. So in slide 2, I'm going to define for you what is assertive communication is. Assertive communication, as I said before, that assertive communication styles, it's allow people to express their thoughts, their feelings, their opinions, and so forth. For example, like you have to speak clearly, respectfully. When you speak clear communication, this meaning like sharing information in a simple and understanding ways. Another one is like expressing thoughts. You know what is expressing thought? When you're expressing, you have to be like expressing your view to a colleague, to a service user, which is also part of the assertive communication. In slide 3, I'm going to explain what the characteristic of assertive communication is. So assertive communications has several important keys which help in health and social care or professionals to use effectively, like families, colleagues, as I said before. So this characteristic is like making eye contact, showing this can show confidence in your speech, interest, and also respect during this conversation. Another one also being calm, tune voice to a service user, example, service user. Another one being listening. This is also part of the assentive communication, active listening. So active listening means paying a full attention to the speaker or genius in what they are telling you or they are saying to you. In slide 4, I'm going to talk about the strengths of assentive communication. That was the topic I chose. So I'm going to talk about their strengths. You know, assentive communication has many strengths in health and social care. It helps professionals to also to talk effectively or provide high quality care, like building trust and relationship. Some like this trust and building trust and relationship, like improvement in teamwork. Sensitive communication also improve teamwork as well. So in slide 5, I'm going to discuss about limitation of assentive communication. So as we talked before about the assentive communication, so also it has also limitation of sensitive communication. Although a sensitive communication has many strengths, it also has some limitation as well, like understanding. This limitation help professionals use their communication style more effectively as well. Maybe assuming like a misunderstanding as being rude. One limitation is that assentive communication can sometimes be misunderstood as being rude, bossy, and like confrontation can occur as well, because assentive communication express their view clearly and confidently. Some people may mistake it confidence for like aggressive. So in slide 6, like let me talk about like a little bit more about this limitation like culture different can affect in interpretation as well as also. So culture different can also affect how communication is understood. In some culture, direct communication is encouraged. I think you get that right. So in slide 6, I'm going to discuss about application of assentive communication in health and social care. So assentive communication is wide use in health and social care setting. It helps healthcare professionals communicate also clearly, like sharing important information, like building a positive relationship, and provide self-effective and personal center care. So in nursing use assentive communication when speaking with patients, families, and doctors, and other healthcare professionals. So when we look about in mental health service, assentive communication help professionals build trust as well, and encourage individual to discuss their feelings and their concern as well. In slide 7, I'm going to talk about how sensitive communication concern like supporting personal center care. So personal center care is an approach that focus on the individual's needs, reference, like values and choice of each service user. It places the person at the center of the care and encourage them to be involved in decision that affects their health and well-being, and encourage service user involvement like one of the key benefits of assertive communication. For example, let me say example like a nurse may discuss some treatment plan for a patient, making like for a patient plan with we ask for their views, and before any discussion are made, this helps ensure that care reflects to individuals' needs and wisely. So in slide 8, I'm going to talk about teamwork and collaboration. So teamwork and collaboration are sensitive in health and social care because many professionals work together to meet their needs of service user, and you're aware of that. So sensitive communication plays an important role in helping team communicate like clearly, respectfully, and effectively. In slide 9, I'm going to talk about recommendation of improvement. Although a sensitive communication is an effective communication styles in health care professional setting, should continue to develop their communication skills throughout their career, like continue learning, helping professionals communicate more effectively to build positive relationship and provide high quality care. So in my conclusion, in slide 10, I'm concluding it by saying a sensitive communication is one of the most effective communication styles used in health and social care. It involves expressing thoughts, feelings, opinion, and concern clearly. Throughout this presentation, I have explained how sensitive communications support effective communication between the health professional and service user, families, and colleagues. It helps to ensure that important information is shared accurately, understanding correctly, and leading to a better care outcome. A sensitive communication has many strengths as well, as I said before. It helps build trust, improve teamwork, reduce misunderstanding, support patient safety, encourage respect, and promote confidently. These benefits are important because they contribute to the delivery of safe, high quality care in a person-centered care. I also discussed some limitation of a sensitive communication. For example, I may sometimes be misunderstood as being rude. Cultural difference can affect interpretation as well, and some professionals may find it difficult to communicate a sensitive communication. A sensitive communicate um, a sensitive communicate due to lack of confidence or experience. However, this challenge can be managed through effective training and practice. I think I'm going to stop here, but before I stop here, let me finalize it by saying a sensitive communication play a key role in supporting person-centered care by encouraging service user involved, informed decision making, and respect the individual's reference. It also improves teamwork and collaborate by helping multidisciplinary team sharing information and work towards common goals. So I'm going to stop here. Wishing you the luck next time we go from here. Goodbye. Thank you for listening.